Today I want to share the story of Dr. Farid Fata. This story became one of the most infamous medical fraud cases in history, not only because of the amount of money involved, but also because of how much harm he caused to real people for so long. So many people lost their lives and countless more were left living with debilitating health consequences for the rest of their lives. And it leaves us with an important lesson. No matter how much you trust a doctor, a second opinion could be the decision that saves your life. In 2012, Monica walked into her doctor's office for a routine checkup. She felt confident that the visit, just like the previous ones, would be quick and uneventful. After all, she had no pre-existing conditions, was healthy and active for her age. But when the doctor ran her blood work, she noticed Monica had elevated protein levels, which may sometimes mean the presence of cancer cells. So, just to be sure, her doctor referred her to one of the leading cancer specialists in the area.
I am Dr. Farid Fata with Michigan Hematology Oncology. I received my medical training at the Memorial Sloan Kettering Cancer Center in New York.
Little did Monica know that Dr. Fata was about to change her life forever. Dr. Farid Fata immigrated to the United States from Lebanon in 1992. After gaining experience in several hospitals, he established his own cancer practice, Michigan Hematology Oncology, specializing in blood disorders. His reputation as a hardworking and ambitious physician spread quickly, and his practice expanded to 7 locations across Michigan, treating more than 15,000 patients each year. At his practice, Dr. Fata worked with his wife, and together they ran a very tight ship. Staff describe him as a control freak because he reviewed all patient files and insisted on seeing every patient himself. Staff said the atmosphere was tense and intimidating, where people felt afraid to question him. He and his wife had security cameras and microphones everywhere, not for safety, but to make sure they told patients exactly what Dr. Fata wanted them to say.
He had cameras and microphones placed in the ceiling and walls, and him and his wife would periodically review that to ensure people were in the right place and saying the right things.
So Monica goes in to see Dr. Fata, and he immediately diagnoses her with smoldering myeloma, a precancerous condition which, if untreated, could become cancer. But Monica is hopeful because it's not cancer, at least not yet. Dr. Fata tells her that treatment would be aggressive, including numerous blood tests, painful bone marrow biopsies, and costly IV treatments that last for several months.
It was a real big lifestyle change. I had never seen a doctor that many times in my entire life.
Fortunately for Monica, she wasn't paying out of pocket. After several months of treatment, Monica returned for a follow-up. She is hopeful that her precancerous condition is treated. Imagine her shock when Dr. Fata told her the precancerous condition had worsened to full-blown blood cancer. And worst of all, he told her that she would need chemotherapy for the rest of her life. In that moment, Monica felt like her world collapsed. She couldn't believe it.
I was sad. I was frustrated.
Before starting her lifetime of chemotherapy, Monica and her husband decided to take one last vacation to Costa Rica. This would be a final moment of freedom before the endless treatment began. After returning home from vacation, Monica goes to the clinic for her first chemotherapy treatment. But you know what they say, tragedy strikes in threes. In a freak accident at home, Monica trips and falls, breaking her leg in 2 places. Her husband calls the ambulance and she's rushed to the hospital. She's admitted there. As Monica lays in her bed, feeling physically and emotionally broken, she's faced with the realization of how difficult it would be to heal from broken bones while going through cancer treatments. But Monica had no idea that the truth about her diagnosis was about to surface, and her life was about to turn upside down once more. While Monica was recovering in the hospital from her broken leg, Dr. Fata was on vacation in his home country of Lebanon, so another physician, Dr. Mongale, was handling his patients. Mongale pulled all of Monica's biopsies, lab reports, and treatment protocols, and after reviewing everything, he couldn't believe what he'd seen. Monica did not have cancer and had never had cancer. Dr. Mongale found out that for months Dr. Fata had been unnecessarily treating Monica for a cancer she didn't have, and when he reviewed other patient records, he found the same pattern of medical malpractice. You see, Fata falsely diagnosed his patients. He told some people they had cancer when they didn't. For others, he exaggerated their illnesses, making them believe they were much sicker than they actually were. Then he gave them treatments they never needed. He prescribed aggressive chemotherapy, iron infusions, and other powerful therapies that were not medically necessary and could be dangerous. And while his patients endured those treatments, he billed insurance companies for millions of dollars.
When a patient came in the door, he sized them up for how can I make the most money off of this person's body? How can I use this person as a commodity? How can I exploit this patient?
Dr. Mongale took all the evidence he had uncovered to the U.S. Attorney's Office, which launched a serious investigation into Dr. Fata and his practice.
In a matter of days, this team pounced on this case. They got the lead on a Friday, and by the following Tuesday, they had shut down Dr. Fata's practice. They had served 7 search warrants at his various offices and home. They had interviewed employees and victims. They had obtained patient files, consulted with experts, and provided alternative medical care for the patients who were going to show up for their treatments on Tuesday morning, only to find that the office had been shuttered.
Investigations exposed years of deliberate misdiagnosis, unnecessary chemotherapy, and extensive insurance fraud affecting over 500 patients. They found that Dr. Fata's practice was the top Medicare biller in the entire country. He had defrauded Medicare and private insurance by almost $17 million. Dr. Fata was charged with healthcare fraud, conspiracy, and money laundering, and pleaded guilty to 16 counts of healthcare fraud, 1 count of conspiracy to pay or receive kickbacks, and 2 counts of money laundering. He was sentenced to 45 years in prison. For a 50-year-old man, that's like life in prison. Monica Flagg survived, but many others did not. Numerous patients lost their lives due to Dr. Fata's mistreatment, while others were left with permanent or long-term harm.
I've developed a compromised bladder, compromised kidney, severe neuropathy in my hands, feet, and legs.
When I think about this story, it shows the importance of asking questions and seeking second opinions whenever possible. Trust matters, but when your life is on the line, trust alone is not enough.